Hey, it's your friends here from Book Podcaster.
Hello, everyone.
And especially to all you amazing nursing students listening in. Yeah, we know. I know the feeling.
Mm,
Your brain is probably just like overflowing with medical terms, care plans, maybe just wanting some sleep.
Definitely familiar territory for many, I think. We get it.
So we thought we'd throw you a bit of a lifeline today, something helpful for your mental toolkit.
That's right. We're doing a deep dive into empowering communication, assertiveness training.
Yeah, it's straight from that chapter in Psychiatric Mental Health Nursing, Concepts of Care and Evidence-Based Practice.
Think of this as maybe a secret weapon for navigating all the stuff you deal with, both in scrubs and, outside of work or school.
Exactly. So our mission today really is to help you unlock that power of assertiveness.
Mhm.
Imagine feeling, well, more in control. Maybe when you need to advocate for a patient or set a boundary with someone or just finally get that study break you desperately need.
Less overwhelmed, more feeling like you've actually got this.
Yeah, that's the goal. So let's get right into it. What is assertiveness actually when we boil it down?
Well, in simple terms, assertiveness is basically expressing your thoughts, your feelings, your beliefs openly, honestly.
Okay.
But, and this is key, doing it respectfully. You stand up for yourself,
Yeah.
but you also consider the other person.
Right, that respect part feels really important because sometimes standing up for yourself can sound aggressive.
Exactly. That's the distinction we need to make. Aggression is different. That's when you express yourself, but it kind of violates the rights of others.
Okay, so it's like imposing your views.
Yeah, or dominating. It's often without really considering the other person's perspective, like trying to win no matter what.
Gotcha. So aggression is like steamrolling people.
Yeah.
What about the other end? Like if someone just doesn't say anything at all?
Uh-huh. That's passivity. Being passive means you fail to express your own needs or feelings.
So you just let things happen.
Pretty much. You let others dominate. Maybe you take advantage, and your own needs just kind of get pushed aside. It's like always putting yourself last.
Which doesn't sound sustainable, especially in nursing.
Not at all. It can lead to burnout, resentment,
Yeah.
all sorts of issues.
Okay. So assertiveness is finding that middle ground. Honest, but respectful. Finding your voice without shouting or whispering.
That's a great way to put it. It's that balanced approach.
And I'm guessing there are some solid reasons why aiming for that balance is, well, a good idea. What are the benefits?
Oh, absolutely. A really big one is improved self-esteem.
Okay, how so?
Well, when you learn to communicate your needs effectively, when you stand up for yourself in a healthy way, it really reinforces your sense of self-worth. It feels good. It's empowering.
That makes a lot of sense. Like you're validating your own needs by expressing them. What else?
Better communication, definitely. That's a major plus.
Clearer, you mean?
Yeah, assertive communication is usually clearer, more direct, so fewer misunderstandings. And that helps build healthier relationships professionally with colleagues and patients, and personally too.
Yeah, I can see how that would cut down on confusion or hurt feelings from things being misinterpreted,
Exactly. People generally know where you stand. You're more likely to actually be heard.
which probably saves a ton of headaches.
It really can. And that leads right into another benefit, better conflict resolution.
Ah, okay. So not necessarily avoiding conflict.
Not necessarily avoiding it, no, but handling it better. When you can express your view assertively, you're more likely to find solutions that work for everyone, respectfully, instead of, things escalating or someone just giving in.
So it's more constructive, handling disagreements without drama, ideally.
That's the aim, finding a way forward together.
Now, the chapter specifically talks about this in a nursing context. Why is this so critical for nurses to grasp, especially when dealing with patients?
That's a really vital point.
Yeah.
Nurses are advocates,
Yeah.
right? So understanding a patient's communication style, their level of assertiveness, is key.
How so?
Well, think about a patient who tends to be passive. They might not speak up if they're uncomfortable or if they don't understand something important about their care.
Like someone being in pain but just not wanting to bother the nurse.
Precisely. Or maybe they just nod along to discharge instructions they don't really get because they're hesitant to ask questions. That can have serious consequences.
Okay, I see that. And the opposite, aggressive patients.
Right. A patient who communicates aggressively might be challenging to build rapport with. It can sometimes hinder that collaborative care process. They might make demands rather than requests.
So being able to assess where a patient is on that passive, assertive, aggressive scale helps you tailor how you interact with them.
Exactly. It helps provide more personalized, effective care. You can encourage the passive patient to speak up, maybe manage interactions with an aggressive patient more strategically.
Makes sense. And the good news is the chapter says assertiveness is a skill. It can be learned.
Yes, it's not just something you're born with or not. There are concrete techniques you can learn and practice.
Okay, let's get practical then. What are some of these techniques? How can you or someone you're helping actually develop assertiveness?
A really foundational one is using I statements. Heard of those?
Vaguely, yeah. Remind me.
So it's about owning your feelings and needs without blaming the other person. You focus on your experience.
Okay, give me an example.
Sure. So instead of saying, you always ignore my input in meetings, which sounds like an accusation.
Right, likely to make someone defensive.
Exactly. You could say, I feel frustrated when I'm not able to share my thoughts in meetings because I believe my perspective could be helpful. See the difference?
Yeah, totally. It's about your feeling, I feel frustrated, and the specific situation when I'm not able to share, and maybe the reason because
Much less blaming.
precisely. It opens the door for discussion rather than shutting it down.
Okay, I like that one. What else? Role-playing is another really useful tool.
Like acting things out.
Kind of, yeah.
Yeah.
Practicing assertive responses like a safe setting first, maybe with a friend, a classmate, a colleague,
Oh, okay. For what kinds of situations?
anything, really. Like practicing how you'd ask for help with a heavy workload, or how you'd set a boundary with a friend who asks for too much, or even how you'd speak up in class.
It's like a rehearsal, building confidence before the main event.
Exactly. It helps you feel more prepared and less anxious when the real situation comes up. You've kind of worked through it already.
Cool. Any other cue techniques?
Definitely need to mention body language. It's huge.
How so? It's not just the words.
Not at all. How you hold yourself, your eye contact,
Yeah.
it all sends a message. Assertive communication is supported by congruent body language.
Like what specifically? Standing tall.
Yeah, things like maintaining appropriate eye contact, not staring but not looking away constantly, having a relaxed but upright posture, speaking in a clear, steady voice, not too loud, not too soft.
So, nonverbal cues that say, I'm confident and I respect you and myself.
You got it. It reinforces the verbal message. If you say something assertive but you're slumped over and mumbling, it doesn't quite land, does it?
No, definitely not. Okay, that makes sense. Now, something else to consider. Culture, right? Does assertiveness look the same everywhere?
Such an important point. No, it really doesn't. Communication norms vary hugely across cultures.
So what's seen as assertive in one place?
Might be seen as rude, or maybe even aggressive somewhere else. Or, conversely, what's normal indirectness in one culture might look passive to someone from a more direct culture.
Wow. Okay, so nurses really need to be aware of that.
Absolutely crucial.
Mm.
Especially when working with patients from diverse backgrounds or even colleagues. You can't apply a one-size-fits-all definition of assertiveness. Sensitivity is key.
So it's about understanding the cultural context and tailoring the approach, helping someone be effectively assertive within their cultural norms.
Exactly. It's about empowerment within their world, not imposing a potentially alien standard.
Good point. To make this all a bit more concrete, the chapter gives some real-life examples, doesn't it?
It does, yeah. Help see it in action.
Let's talk through one. There was one about a nurse, Sarah, feeling overwhelmed.
Right. So Sarah, the nurse in the example, often felt overloaded, but, hesitated to speak up. Classic passivity, maybe.
Sounds like it. So what changed?
Through some assertiveness training, she learned to communicate her needs more directly but still respectfully.
What does she actually say?
The example quote is something like, I am currently managing several high-priority tasks, and to ensure quality patient care, I need some support to meet these deadlines effectively.
Okay, that sounds professional. And direct. How did it go down? Did the manager get upset?
Nope. The outcome was positive. The manager apparently appreciated her honesty and clarity. They worked together to redistribute some tasks.
Nice. So better workload for her, probably better care for patients. Win-win.
Exactly. It shows assertiveness isn't about complaining. It's about problem solving and advocating for what's needed.
Great example. What about the other one, John, in his personal life?
Yeah, John's scenario was about friendships. He tended to be maybe too agreeable, always saying yes, even when it drained him.
Putting others' needs way ahead of his own. Passive again.
Seems like it. The training helped him practice setting boundaries.
So, like, saying no?
Basically, yeah. The example given is a friend invites him on a last-minute weekend trip he just doesn't have the energy for.
Okay, the old John might have just gone, right, even if exhausted.
Probably.
Yeah.
But the assertive John learned to say something like, Thank you for the invitation. That sounds fun, but I won't be able to make it this weekend. I really need to prioritize some rest.
Direct, polite, gives a reason but doesn't over-explain or make excuses. How did the friends take it?
According to the scenario, they respected his decision, and John felt better, more in control, less resentful probably, healthier relationship boundary.
It really sounds like being clear, even at saying no sometimes, leads to better outcomes in the long run.
Often, yes. It builds relationships on honesty and mutual respect, not obligation or resentment.
Okay, so those are good examples. But trying to be more assertive, it's not always easy. Are there common mistakes or fears people run into?
Oh, definitely. A big one is the fear of rejection or starting conflict.
Yeah, like worrying people won't like you if you disagree or say no.
Exactly. People worry they'll upset others or damage relationships if they express their needs directly.
What's the counter argument to that fear?
Well, the idea is that true assertiveness, done respectfully, actually builds healthier relationships based on honesty. And while someone might initially be surprised, it often leads to greater understanding. It's not about creating conflict, but navigating disagreements healthily.
So it's actually about preventing bigger blowups later, maybe, by addressing things clearly.
That can certainly be part of it. And it avoids the exhaustion of constantly trying to please everyone.
True that. What other mistakes do people make?
Another common confusion is mixing up assertiveness with aggression. We touched on this, but it bears repeating.
Right. Thinking that to be assertive, you have to be forceful or demanding.
Exactly. It's crucial to remember, assertiveness is about respect for yourself and others. It's not about controlling, dominating, or being pushy. It's about clear, honest, respectful communication.
Finding that balance again, self-respect without disrespecting others.
Basically, it's a nuanced skill.
So for the nurses listening, if they want to help patients or even colleagues or themselves develop this skill, what specific nursing interventions are helpful?
Great question. One really powerful thing nurses can do is model assertive behavior themselves.
Lead by example.
Absolutely. Using I statements in their own interactions, setting clear professional boundaries, communicating calmly and respectfully, even under pressure. That provides a real-life example for others to see.
That makes sense. Patients see you handling a difficult situation assertively. Maybe it gives them ideas. What else?
Providing feedback and support is vital. When a patient tries out an assertive technique, maybe in role play or a real situation, giving them positive reinforcement.
Like, hey, that was great how you stated your need clearly.
Exactly. Or offering gentle, constructive feedback if it didn't quite land right. That encouragement builds confidence and helps them keep practicing. It makes it feel less scary.
That support sounds crucial. Anything else?
Yeah, one more tip is to encourage starting small.
What do you mean?
Don't try to tackle the most terrifying high-stakes conversation right off the bat. Encourage practicing in everyday low-stakes situations first. Like making a simple request, expressing a preference about food, asking a question in a non-urgent setting. Little things.
Yeah.
Build up the muscle, you know.
Dip your toe in before diving in the deep end.
Exactly. Build confidence with smaller successes before moving on to more challenging scenarios.
Okay, that seems like really practical advice. Start small, get feedback, learn from examples.
It makes the whole process feel much more manageable.
All right, so as we start to wrap up this deep dive, let's crystallize the main takeaways. What do you really want our listeners, our future and current nurses, to hold on to about assertiveness?
I think the biggest things are,
Yeah.
1, assertiveness is a skill. It can be learned and practiced. 2, it's incredibly valuable for your communication, your self-esteem, your overall well-being.
Both at work and outside of it.
Absolute. And 3, it's about that balance, finding the sweet spot between being passive and being aggressive, expressing yourself honestly and respectfully.
Yeah.
It's crucial for advocating for patients, for collaborating with colleagues, and just for navigating life.
So for everyone listening, as you're navigating your studies, your clinicals, your future careers, those long shifts we mentioned, just remember your thoughts, your feelings, your needs, they matter. They're valid.
So important to remember that.
And learning to express them effectively, assertively. It's not being difficult. It's actually a real strength. A superpower, almost.
I like that, superpower.
You're juggling so much already, and just taking the time to understand this stuff, it shows how dedicated and capable you are. Seriously, you've got this.
You really do. Keep learning, keep growing.
Now go tackle that next chapter, or maybe just grab a decent cup of coffee first. You definitely deserve it.